everyone. Glad you could join us tonight. We got Dr. Larry Lieberman tonight joining us, and I think you're going to find this fabulous. His knowledge on PBM is extensive. He's got over 30 years. I don't know exactly the number of years, but using laser in his dental practice and going and teaching photobiomodulation, world of knowledge on the whole area of PBM and how it can make a difference. So tonight it's going to be fabulous to have him on. And because we're running a little late, we're going to start right in and to this. And I'll just a little housekeeping. Our winner tonight, sorry, I just had it here. Oh, misplaced it. Okay, we do have a winner for sorry? Your glasses maybe? No, it's a bigger sheet. Anyways, oh, here we go. Jill Larusinini. Jill, congratulations. You won a Palm Ultimate. That's the device like this, $1,300 value, and you're going to have a lot of fun using that, helping a lot of people, including yourself. So thank you for joining us for a webinar or two or maybe four, I don't know, but for the month of August. So congratulations. So now we're going to have a special guest on. Larry, let's see if we can get you talking to us. Larry, I wish we could have your face up, but it's not going to happen.
I know,
tonight.
I wish we could too. For you, but you don't even know about it.
There you go. There you go. So Larry, how long have you been in using PBM in your practice?
Well, I started using PBM about 25 years ago.
Okay.
The way it turned out was my wife had torn cartilage in her wrist from walking our big golden retriever. And I went to a laser meeting, and I started using lasers about 30 years ago. And I was talking to this guy who had this low-level laser, and he said it was $5,000. And he said, if it doesn't help your wife, you can send it back. I'll give you all your money back. And I would do anything at that point because she had been in a lot of pain and gone to several orthopedic surgeons, and nobody wanted to do anything because they didn't know if they could help her. And I bought this low-level laser, and we used it every day for a week, and the pain all went away. It was like a miracle. It was incredible. I told her just to keep going, keep using it. So she used it every day for 3 weeks, and then a couple of months later, we took X-rays, and the cartilage all got repaired. It was unbelievable. So that's what, I became a believer. I also learned how to use the acupuncture meridian, because the meridian for the wrist is the elbow and also at the shoulder. And it was just something that I would have paid 10 times more than that to get her out of pain. And it worked. And I've been using, photobiomodulation ever since, learning a ton, seeing so many miracles. And that's why I'm so passionate about it. And I teach at I have an advanced laser training institute. And I always tell my students that it's the most underdone thing in medicine in this country. And I was so happy to see that they finally have a code for medical people, for the AMA to bill insurance for photobiomodulation.
I just found out about that today.
Unbelievable. I am so excited about that because I have so many friends that are docs, and when I talk to them about photobiomodulation, and if they're traditional medical guys, they want to see double-blind studies in the New England Journal of Medicine, and they don't believe it until they actually see it for themselves. And now that there's a code for it, they can actually bill for it, then a lot more medical doctors will start using it. So I'm excited about that.
Yeah, that's beautiful. That's beautiful. Now, had you used lasers prior to that for other aspects in dentistry, or not, that this was your first exposure in the PBM world to a laser?
I started 5 years before that. I had gotten a diode, and it worked well, for what it was. And but this was the first time I got into the photobiomodulation, and I became a quick believer. And I mean, I just saw things happening that, was just incredible. I mean, talking about, people I didn't believe, my best friend was the chief of medicine at the local hospital. And he was one of the traditional guys that wanted to see it in the New England Journal of Medicine. And his son had a polynital cyst. And they did 6 surgeries on him. He was 17 years old. He was a popular guy. He dated girls. He played baseball. And he would bleed all the time out of this polynital cyst that was in the base of his spine. And, they were going to put him on an IV antibiotic to kill the bacteria. And that just did not make sense to me. I said, Rob, let me try using my lasers. And we used it every other day for a week. And the polynital cyst closed and never opened again.
Yeah.
It was incredible. He became a believer, luckily.
That's the hard thing. Most people have to actually see it happen either on a close friend or family member or themselves before they believe it. And I got to say, rolling back about 17 years ago, I was pretty skeptical. I had developed the blue light 3 years prior for hardening the white fillings. So it's called the Blue Wand. So it was the first high-power blue LED for curing fillings, and I competed against 3M. Well, that's no fun to compete against 3M.
No.
They kind of have the market, and so it didn't go that great, although I sold my device to somewhere around 100 dentists or more. They loved my light, but it was just so very difficult moving that forward. But that made me ready then for when I met this one doctor, and I still didn't believe light could do anything on the body directly, but I could believe that light could, stimulate a catalyst or make a catalyst to harden a filling. So when that doctor told me, hey, this light this drug could be initiated by light, and that light and the process would kill those bad C cells, this was amazing. And so I started working with him, and 2 months later, I had re-injured myself from a fall that was probably about 20 years earlier, severe back pain. And I thought at that point, this very powerful red light that I made for this term photodynamic therapy, I thought, I wonder if I just tried that light on my back. And I had probably a pain of about 8. And, I could barely think. It was screaming at me. And I put that powerful light behind my back. And about 20 minutes later, I was like, what just happened? And it felt like the pain had dropped to probably around a 3 out of 10. And when I got up out of the chair, I got up really slowly, as I would when I injured, injured my back. And, every year, 2 years, this would happen, this pain. And it's like in 20 minutes, I've dropped that much pain. And when I got up out of the chair, it's like, oh my gosh, I can almost touch my toes. It was that dramatic. So that was what finally woke me up, that light can actually do something on the body that way. And
it's incredible. I mean, I told you, Tom, I never go anywhere. I mean, I travel around the country, around the world, and I never go anywhere without my palm,
right.
My palm laser, because you never know when you're going to need it. And it's just incredible.
Now, just for clarity for the listeners tonight, when you talk about laser, you're going to use laser a lot as a term, but it's only because he's had 25 years of indoctrination of laser, so it's really, really hard to remember this device as an LED. Laser goes in hand with PBM, but in this case, our devices are LED devices. And Larry, I think you probably saw that research that I did where I compared going through 2¼ inches of steak with a 1064 nanometer laser, 5 watt, and my 5 watt 5 watt palm, the super palm device at 1050, and the light level measured through the 2.25 inches of stake, there it was indiscernible, very little difference between the amount of light energy coming through that 2.25 inch stake, three layers of stake. It made no difference whether it came from the laser or my palm device. There is a difference when it comes to cost, though.
For the cost, and that's why it's so important that people really do understand the difference. Because I mean, I have 3 lasers in my office that are $100,000 plus, but I also have another 15 low-level lasers at home, and that I lend to people and I use outside of the office. And it's just the LEDs, the red light and infrared, they work really well. Red light's more for, obviously, for surface stuff, for skin, for eczema, for wounds, and the infrared, the near infrared is more for deeper tissue.
Yes.
If you want to use for an elbow, for a knee. And that's why I've lent mine to I live in a building in St. Petersburg, Florida, and we have 240 units in our building. I probably lent them out to over 100 people. Because everybody's playing pickleball and a lot of other sports. I mean, pickleball took me down also about a year and a half ago. But it just, by using it, it just makes it so the pain goes away and it heals so much faster. So that's why it's important to know the difference. And then you look at it and you say, okay, what's the difference between buying an LED, from, Amazon or ones that are made in China? And that's where I had to really get educated, because a lot of the ones that come from China, you have no idea if they're overpowered, if they're underpowered, or they're just Christmas lights.
Yeah.
And that's one of the reasons. And that's one of the reasons I went to you, Tom, because back at the beginning of COVID, I had a really good Tom type laser or LED that worked really well, and it came from China, and it was imported here through a Canadian company, but it couldn't get the lights anymore. And that's when I called you up, if you remember, and
Right.
told me, you have the lights and they're made in Canada, and I said, okay, I want one. And at that point, I've gotten them for probably 60 or 70 of my students, and I've gotten them, several from my family members, and it's just been really something I've relied on, and just appreciate so much what you've done. And I want to not forget to just thank you again so much, because when after October 7th, when Israel got attacked, you called me up and you said, Larry, I want to do something to help Israel. And you said, I want to send lasers to Israel, to the rehab facilities, to help all these people. And you did. And I just appreciate that so much. And I appreciate your care and concern, because a lot of lasers were made in Israel. A lot of the technology comes from there, and they loved it. And they were so grateful. So I just wanted to thank you again for that, Tom.
Oh, well, I just wanted to help in whatever way I could, but it was a great opportunity, and you connected me as well. So, as a matter of fact, one of the devices, I'm working with a fellow from Israel right now that has been able to regrow spinal cord nerves successfully. And the one thing is he's been able to develop, he's a neurosurgeon, and he was able to develop a scaffolding material to help the nerves grow back together. One of the challenges, as you would know, Larry, is that scar tissue will impede anything in healing. And when it comes to the nerve, that when the nerves try and grow together, even with this very special scaffolding, the scar tissue will impede the nerve to the point where his success rate was he was only getting a 20% nerve function when he used the scaffolding. And that's pretty much a useless nerve at that point, even though it went from 0 to 20. But he found out that if he uses light technology, PBM, photobiomodulation, red light therapy, cold level laser therapy, low level laser, whatever you want to call it. The main term now is photobiomodulation. When he was able to use photobiomodulation on that nerve during the healing process, that nerve was able to reconnect with an 80% functionality. So he's thrilled, and he's working with me now. We're just looking at trying to get some funds raised to help this nerve regrowth happen in the United States, so that we can help some of these. When it gets started, there's going to be quadriplegics and paraplegics that we'll be able to see helped with our technology. And the big thing about ours is just that it's really, really easy to use, the LED technology, with a lot of light power without a big ticket behind it financially, but very easy to distribute. A very nice wall. We call it the wall of light over the nerve area where the nerve is deeper in the spine, or somewhere along that, where it comes out or wherever it is. But
they know about this all over the world, whether it be Israel, Europe, South America, wherever I go, I look into it and see what they do. I met somebody down in South America who had surgery on her legs, and her nerves they weren't healing. And I asked her if anybody ever talked to her about doing some photobiomodulation. And she says, "Yeah, my doctor just talked to me about it this morning." And so I helped her get a device. And you know what? She's getting better, because it accelerates the healing of it. And that's why, and that brings me to the dental stuff. I've seen it work great for paresthesias. I've seen it work great for, things in dentistry that really make it so it makes my life in dentistry even better, because it helps my patients so much, whether it be a TMJ problem. I mean, I've never seen anybody with a sore TMJ that I couldn't get rid of their pain in less than 5 minutes.
Yeah.
I just never seen it. It's just incredible. I mean, I'll do courses, and I'll have somebody that's in a lot of pain, and I'll do, I'll put it on their face for 5 minutes, and pain goes away. And then all of a sudden they feel it on the other side, because they didn't realize the other side was hurting. And then I get rid of it on the other side. It doesn't get rid of the cause of the pain, but it gets rid of the pain. So
Yeah.
at least they can start healing, and they can start functioning. And if they have one at home, they can use it whenever it hurts like that. But they still need to have, the root cause, obviously. But there are so many things in dentistry that I use it for. Anytime I do a long treatment in dentistry, I do a lot of full mouth kind of reconstructions where somebody might be in the chair, for 5-6 hours. Always put it on them. After a root canal, after any procedure where that's potentially difficult for somebody, keeping their mouth open. Even for sensitive teeth, the lasers are great to help get rid of the sensitivity. And you have a probe that's on the palm also that goes intraorally, that can reach the teeth, which have made it really nice to really diagnose whether the tooth needs a root canal, or where you can get rid of the pain. If I don't get rid of the pain, then I think that, if it's a sharp pain that they feel when I put the probe on them, then there's a good chance they need a root canal. So these things have helped so much, because I've seen teeth where people come in and pain, 7, 8, 9 out of 10, and it goes away within a few minutes.
Yeah.
It's incredible.
Yeah, it was really funny. My landlord and his wife invited me over to share the story of the light with their good friends. And my landlord was somewhat skeptical, but his wife wasn't, and that she wanted that to happen, that I would come down. Well, their friend came over, and the husband and wife, and she said, as we're talking, I says it can help with all kinds of things, and she says, "What about tooth pain?" She says, "I've got it right now, and I've been taking Tylenol, keep taking Tylenol on this one." And I says, "Well," I says, just put the palm light, in this case, on her cheek." And my landlord was looking at me, "Oh yeah," like that's going to do something. I says, well, I think it probably is going to help reduce some pain. And about like it was about 5, 7 minutes later, she said, the pain is gone. There's no pain there. And my landlord was like, come on, I forget her name, but he says, come on, you don't have to make it look good here, like it's okay, you got some pain there, she says, no, 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 you don't understand. The pain is gone.
Yeah.
So,
I mean, I mean, to be able to do that for people, is just, it's so rewarding, and and I can't believe, and that's why I've always said that using, LED, using light is the most underdone thing, and that's why I'm so excited that finally, traditional medicine is waking up, because they were doing research at the National Institute of Health, and they started doing that a couple of years ago, where they finally started looking at it for people that came back from Iraq and Afghanistan for PTSD, and that's where these brain caps started working, because they realized that the light goes through the skull to the brain, where the most mitochondria in the body is in the heart and the brain. But light, as you know, excites the mitochondria in the brain, and it helps the people with PTSD, with strokes, with autism, with Parkinson's, and other things that you've had on your webinars. Dementia and Alzheimer's don't accelerate as fast. They don't reverse it, but they keep it from going as quickly. So these brain caps, have been such a big help for people. So one of my best friends in dentistry had a stroke about 2 years ago. And 11 months after he had the stroke, I said, Jeff, you really, you're sounding pretty foggy. I said, please try this brain cap. And I got him the brain cap. 5 weeks later, I'm talking to him, and he sounded like the old Jeff. I said, let me talk to your wife. I said, is it my imagination, or does he actually sound better? He says, Larry, it was like a light switch went off. All of a sudden, he started feeling so much better and sounding so much better.
Yeah.
So these things happen. They repair, which is great to see.
Well, the one fellow, I'm not sure if you know him, but the fellow overseas in England, Dr. Mark Cronshaw, one of the things that we were talking about is, you talk about the acupuncture points, but they have also found out that the myelin sheath of a nerve can actually carry light. So like a fiber optic. So it's possible that the light from, let's say, on a surface can go far, far deeper just by following the nerve, the nerve channels through the myelin sheath. So he was talking about it. Do you know Mark
I don't know him.
Yeah, great. Another great dentist in England, and he's done all sorts of work and research in the PBM as well. And we were talking about. He was telling me more and more about this phenomenon that we always thought we're just electrically wired, but now we're finding out that there's a whole fiber optic network on top of that. So our bodies are beautifully designed.
Oh yeah, and that's why I always tell my students when I'm teaching them in my laser institute, I always say, whenever there's pain or inflammation in your body, think photobiomodulation. Whenever there is, and they'll say, "What about this?" I say, "Whenever there's pain or inflammation, unless there's a tumor there, because what's happening, right? You're increasing the ATP, which is going to give it energy. You're increasing nitric oxide, which is going to cause vasodilation and get more oxygen to every tissue. You're going to increase fibroblast production. You're going to increase cartilage. You're going to increase bone. You're going to do so many things to make everything heal better and feel better. So unless it's a tumor, everywhere is good for photobiomodulation.
Yeah.
I mean, I've healed people with Bell's palsy with it. Where MDs generally, what they do is they just give somebody an antibiotic, and they say, see you later. And they say, what, you're going to leave me like this? It'll go away sometime. Well, people are miserable. And if you get them with photobiomodulation as soon as possible, it can go away in a much shorter period of time. So these things, they work so well. I mean, I use them for people that gag, because if you put the light over the acupuncture point P6, which is right above the wrist, It's 2 fingers above the inside of your wrist, and you put the light over there for about a minute, or you put it also over the mental labial groove right above the chin, below the lip, and it makes it so you make it so somebody that's shaking from Parkinson's disease, you can actually do dental work on, or somebody with a severe gag reflex, you can do procedures you never could do before. I mean, there's so many ways that this stuff can help dentists. I don't know how many people on the webinar are dentists, or if they're physicians anywhere in the medical community, but these things can help everybody. And that's why I tell people, whether it's your patients, whether it's your family member, your friends, I mean, you have to understand this, what it does to make everybody's lives better.
So in your own situation, what did you use it for? Did you use it on some parts of your body?
Well, after COVID, when I started getting the palm, a couple of places that I really started to work with one thing was my wife, though. She had, in addition to the cartilage 25 years ago, she went to the doctor, and she had arthritis in her knee. And they told her to, do PRP injections, and it was going to be 3 to 4 injections, and it's going to be $6,000 to $8,000, and they didn't know if it would help her. I said, honey, please, we have so much stuff here to help healing. Use the palm every day for 3 weeks, and if it doesn't work, we'll do the PRP. And sure enough, the pain all went away in her knee. We went to Eastern Europe. I took it with us because I'd never go anywhere without it. And when she used it, whenever she felt sore, and she was able to walk wherever she wanted and didn't have any discomfort while she was there. And she still uses it instead of getting surgery, instead of getting PRP, because the laser helps it heal.
Yeah.
So for me, I tore my Achilles from pickleball, which I mentioned a little while ago, and that was awful. And I used it on my Achilles area all the time. And then I also had to use it on my back, because from limping for so long, it makes it so the other side, the contralateral side where you're limping, your back starts to hurt. So these things help so much. And then, and I've gotten your mini canopy. I bought that for my son, who had eczema since, he was born, and he had cradle cap, and he was on steroids, and he didn't want to be on steroids anymore. And he had all these lesions on his body, and so I bought him the mini canopy. And these things help a lot anytime there's any sort of skin irritation, skin lesions, psoriasis, eczema. There are other things besides drugs to help people. And I'm just grateful for you and, what you've done to create something that I can trust and that I can, tell my students and tell other people about that works.
You said about your Achilles, very first product going back about 16 years ago when I first learned then, I had a different light source. LEDs at the time were far too expensive, but I figured out a way to filter away the far infrared from the halogen bulb. And anyways, I developed this device that then could give you high amounts of light using halogen bulb, and we made a handheld version. It looked like a hairdryer, pretty heavy thing, and it worked beautiful. But the guy who was the president of the company I founded, he eventually took on the president role, and he was doing a basketball shot, just kind of winging it and having some fun, and he tore his Achilles tendon right off. So they reattach it. No, this was during the springtime, like early spring. And he tore his Achilles tendon right off, and they reattached it. And he says, how long is it going to take? Because I really like golfing and I want to start golfing, as soon as the weather breaks. And they said, no. Just get that out of your mind. There's no golfing for you this season, and you'll have to see about next season. And anyways, he says, I just I'm going to use my light technology, and I kind of laughed about it. He was involved with me then at that time, and so he used this light on his tendon area, and every day and several times a day, as a matter of fact. And within 2 months, he was back on the golf course. And at first he was using the golf cart to get around, and eventually he said, I was able to walk again, totally. He still could walk, but I mean, it takes time for everything to fully heal. And
How old was he?
at the time, he would have been about 50, around 50.
Well, that's pretty good, because I know Bernard Langer tore his Achilles around the same time that I had surgery, and he was a mess afterwards. And he was golfing again a while later, but it's hard because you can't put weight. The Achilles is a tough injury, and golf is one thing, but then you see guys like Aaron Rodgers and Kirk Cousins, who tore their Achilles last year or a year and a half ago, and it was tough for them to come back last year because it was hard for them to move. But the light helps a ton. And another place that the dentist would be interested in is for oral mucositis, because oral mucositis is a really bad thing that happens when people got radiation to their throat, their mouth, and it makes it so they just get sores everywhere, and they can't eat, they can't drink, they can't sleep. And I had this woman, Leslie, call me up when I was away, and when I came back, I said, let me get you in right away. And I saw her every other day for 6 weeks, and I did combination of lasers in my office, combination of the palm. I gave her one of my palms to use at home, and she looked better than any of the other people in the clinic. And her oncologist said, Leslie, how come you look better than everybody else? It's like, she says, well, I got this, these lasers from my dentist. And he says, oh, okay, sure. Right. And she comes back again a couple of weeks later, and she's looking better than everybody even more. And then he says, well, what was the name of that guy? And then the guy called me up, and he says, what are you doing? He says, I need this stuff.
Yeah.
It's incredible. It's the only thing that helps them is the light therapy. Because, most of the time what, docs will do, they'll give them some, magic mouthwash or something to help, soothe it, but it doesn't work. People a lot of times die because they can't get any nutrition and they go on a feeding tube. Well, Leslie was about to go on the feeding tube when I saw her, and she never went on a feeding tube, and she looked great. So she was just so grateful.
Yeah, we've helped some people with different forms of oral mucositis, and it really does help. As a matter of fact, some who start off with chemotherapy, if they start right away with the oral treatment with light, they can totally avoid oral mucositis. It's pretty neat to see.
What people do that, and that's what I told the oncologist. I said, if you start them off right away, and you start them up with, before the radiation, and you start them, and before it happens, they're just not going to get it. And it's been shown over and over again, which is great to see, because it's just so debilitating. People just lose their zest for life. They just don't even want to live anymore because they're in so much pain all the time.
Yeah. And for those that don't know, oral mucositis is when the tissues break down inside the mouth. You can have a whole spin of other things, dry mouth, a whole host of things, right, Larry?
Yeah, I mean, it's extremely painful, and that's why they don't eat, they don't drink, they can't sleep, and that's why they fail, and a lot of people just, they just die at that point. And that's why it was so good for this guy to actually see this woman, Leslie, come in and look as good as she did, because it really showed him. So anytime I get a chance to talk to an oncologist, I just love to be able to educate them, because, again, most of our physicians in our country don't know anything about low-level laser, about photobiomodulation. And that's why, if anybody out there, if you Google photobiomodulation and anything, there's stuff on it all over the world. It just didn't do so much in our country. And that's why I get so frustrated when, docs I knew who were good docs, caring docs, just relied on drugs and didn't do things because if insurance wouldn't cover it. But now that insurance will cover it, I think they're going to start waking up.
Yeah, that's for anybody who started later in this conversation. The news of the day just came out to me today, and I sent it out to a bunch, including Larry, about how there's two new codes for insurance for treatment with photobiomodulation with to do with dental, and it was launched through the American Dental Association. So that's been.
American Medical Association.
Oh no, I think that was AD. Wasn't it AD? I think that's ADA. That document, not AMA.
Oh, was it?
Yeah.
Oh, okay. I thought you told me it was the other one. Okay, good. So,
maybe I did a typo. Sorry, maybe I did a typo, but it's ADA. But hey, that's good start, anyways. A really good start.
Oh, that's a great start. That's a great start.
And the first time.
More excited.
This is the first time after all these years. Hey, all the work that you've done, all the work that I've done, just to see it first come up just today. So that's excellent. So what I'm going to do, Larry, is just for a moment, I'm going to do a little housekeeping here for 5 minutes, and then we're going to answer a bunch of questions, you and I together, and I'll have to read them to you because you can't. Unfortunately, today we tried to have Larry's online as a video with his face on here, and I'd love to have had that. I think this is a little different webinar for sure. I haven't done it this way before, but anyways, it turned out. But Larry, I just need a few minutes here, and then I want to start answering questions with you. So let's. So I'm just going to share with everybody here what we have. We have a series of palm lights. They range from $975 to $1,900. Now, the $975 one is the red and the near infrared of 810 nanometer. And those two wavelengths, as we've been talking about, are fantastic. And that's called the professional. And I actually started this one using this one in the dental field, and we got really good results with it. As I started moving along, I thought that if there was some way of getting even more power, I would make a little different palm, and I figured out a way to do it so that it's, even though it's the same size, it now has 25% more power optically for the red at 660 nanometer and the near infrared 1050 nanometer. So anyways, those two just with more power. So that's the $1,300 one. And then our best unit is the Super Palm, which is the 1050 nanometer. And that one has the same power as the 810, the Ultimate with the 660. And then it has 1050 nanometer, which for me, when I look at it, all I see is nothing except for this one red light right here. But in the camera, you can actually see these little purplish glow. That's because our eyes can't see this wavelength. But if I can show you how far it's going. It's going right through my hand here, no problem. That's how much power we have there for the 660. And when it comes to the 810 or 1050, we can get measurements through my hand on the other side, anywhere from 10 to 30 times more optical power comes through at the 810 or 1050 nanometers. So a lot deeper penetration with those wavelengths. So people will use both wavelengths because the red definitely is good for all kinds of things on the skin level. But also it's also being absorbed by the blood, and the blood's taking it around and going far beyond where you're treating. And then when it comes to the 1050 nanometer or 810 nanometer or 1050, that's the wavelength that's going to penetrate quite deep. So you're going to be able to reach the hip joint, shoulder joints deeper in. And what I like to do for people too is show them that the red light, people think, oh, hey, how's that possible that the light will go into my skull? Isn't the skull going to block all the light? No, it's not, because the skull is a high mineral content. So this is a real human skull, this one here. I'm very thankful. We gave him the name Alfred, and Alfred was donated to me from one of the dentists, and I'm very, very thankful to him for doing that. But as you can see, the very bright light, and there it's going through. So I can move that light in here, and you can see it going right through. Matter of fact, really cool. You can see the design of the sutures through the skull, through the areas attaching the bone, the skull together. But the light goes right through the skull without any problem. And again, when it comes to the 810 or 1050, far more goes through the skull. And bone actually does even, not only does it go through the bone, but it conducts the light along the bone. So it's pretty neat to know about that. It's almost like if somebody knows the term light pipe, it's actually like the light transmits along the bone. And as we talked earlier in our conversation here, light can travel along the nerve fibers. So it can go far, far further along than normally one would think. So they've been able to go, like, just think of fiber optics. You can use a very, very small amount of light and transmit it miles through that fiber optic. Well, guess what? We got fiber optics kind of built into our body. It was designed that way. So, anyways, I got into a little side topic because but I was trying to demonstrate the palm light. By the way, for the next 24 hours, I'm going to offer everyone who's listening, hey,
guess what? I just was able to get on.
Okay, I'm going to hang up this way, and then there we go. All right. Well, I don't mind the background you are in there. That looks pretty neat.
It's pretty nice here.
So do you have your palm within reach?
My palm is actually, my wife is putting it on her knee right now.
Oh, all right. Okay. We're not going to take it away from her. No, not a chance. Not a chance. Well, this is so neat that you were able to get on.
Yeah, I've been trying, believe me. It's like, technology can be so great, but it can be so frustrating sometimes.
You're not just a kid. So now, would you be able to see the questions or not on the
Okay,
side?
let's see here.
In your chat area.
Okay. And I don't see the questions yet. I put up the chat.
I'll tell you what, I'll read them out to you. There's not that many. And please remember, everyone, to I hear I'm scrolling around on my own computer trying to get but okay. Let's see, scroll down. Yeah. So what's happening to a cataract when a red light is used on? Okay, Carrie is asking, and this is one thing that we've seen, Larry, is I don't know if you've had seen anybody using the light for their eyes, but what we've been using for the last I don't know, about 8 months, I think, is to close the eyelids so that what happens is any light hits it, it's going to be so diffused in the back of the eye, there's no hot spots whatsoever. And they do 1 minute of the red and 1 minute of the near infrared. And we've seen some absolutely outstanding results with wet macular degeneration, dry macular degeneration, glaucoma, and cataracts. We got some cataracts that
I've also seen it help people with diabetes retinopathy.
Yes.
Which is incredible. A lot of people with diabetes end up going blind, and I've seen people help keep their sight with it.
As a matter of fact,
anywhere there's inflammation, anywhere in the body there's inflammation, and I don't care where it is, it can help.
Yeah, well, one thing that I didn't put the pieces together till I had a meeting. I was involved in a meeting, and I put the question in the super chat it was a meeting about autism, and I asked, is there any neuroinflammation going on with somebody with autism? And the whole panel was like, there was quite a few people on this panel. They all said, absolutely, and I'm thinking, we're the inflammation busters, the old Ghostbusters. Well, we're
Right.
the inflammation
Exactly.
busters, right? And we can actually reduce the inflammation in the brain with the light, even the palm light on its own. I got the helmet. I was just showing you, talking about the cap, and here's mine. This is a very powerful
That's
light,
great.
and it's 10. It's got actually 10 of the palm lights basically distributed over the whole surface. So you got a very even illumination on the brain. That's the red. And then we have the near infrared, either the 810 or the 1050. But that's our helmet that we have seen beautiful, beautiful results. And the whole discussion about inflammation in the brain, I didn't realize until kind of that moment as I was putting pieces together and then starting to ask the questions all over. Is there inflammation in the brain with Parkinson's? Yes. Is there inflammation in the brain with Alzheimer's? Yes. What about the dementia? And you go down through the line: strokes, concussions, all those kinds of things. You have a component of inflammation in the brain. And if you can reduce the inflammation, then hey, that person we've had people notice even a change in the very first treatment. And that treatment is 4 minutes, 1 minute of red, 3 minutes of near infrared. And I had one individual, senior, tinnitus. He had for 30 years roaring of Niagara Falls in his ear, and he did one treatment with the helmet, and immediately the noise in that ear dropped so substantially. He says, I can hear people talking now in this ear. When he closed off the other ear, he could hear it. And it's something there that a person's going to maybe have to treat for the rest of their life in that situation. Maybe a couple months and it'll go away, but others are going to have to treat it on an ongoing basis. Like you say, like to slow down the decline that a person might go through with some of these neurodegenerative diseases, right?
I saw something in the chat here about they thanked us for talking about diabetes. And that's something that we didn't talk too much about. And I know you have on other webinars, but I remember when my dad passed away many years ago. He had a bad infection in his big toe, and they just couldn't get rid of it. And I didn't know about photobiomodulation then.
Uh,
And I know if we would have known about it, he would have been able to keep his leg, and he probably would have been able to stay alive because he just did not want to live like that. You
well,
know,
yeah, when they lose a leg, usually they don't want to live much longer than that. Then their trajectory is downhill pretty quickly. We had the fellow who does my patent writing for me. He had a good friend that for years he's had this diabetic foot ulcer on the bottom of his foot, so he couldn't walk on his foot, and it got worse. It like just kept getting worse, and he was in the hospital for quite some time, and they said, well, you're looking at amputation. And my friend brought in for him, it was just bring the mini canopy. It'd be far easier just to do his whole bottom of his foot, and just a much quicker treatment. Well, he
right?
did it, and 1 month later, this hole that he's had in his foot for years was like almost totally healed over. All the skin around it was white as a ghost, was now all with beautiful color, and that so the blood was flowing through the whole area. All that
How grateful was he?
Oh, yeah. I mean, he's probably now looking at walking out of the hospital any day
Right.
because of his friend dedicating a month. So went in every day. Now, could he have gotten away with 3 treatments a week? Maybe. I don't know, but definitely doing it daily, there's no harm that I've seen, and even faster healing.
Well,
So
that's why I'll use. It's great now, especially with medical doctors being able to do it and get paid for it finally. But if you do it with and some of your big lasers, because there are some big ones that you can have in the office, but you're not going to have $100,000 laser at home generally. And then if you can have the palm wherever you go on the alternate days, or if you're traveling, it's just a perfect combination
right.
because the palm because a palm will do pretty much what the big lasers do, but it's much more portable and much less expensive.
Yep. Yep. No, in this case, this is 15 of the palm lights, the power of 15 palm lights, this device here. It's like a foot square. So, I do have clinics that are using it, and some people have bought it for their personal because they've got large areas of their legs that they want to treat and they want to do it fast. So, this is 15 of the palm lights in area and about 12 times the optical power. Maurice is asking, how's the gentleman doing with Parkinson's or a gentleman with Parkinson's and Lewy body dementia? So we had some good results with Parkinson's, and I'm hopeful that we'll be able to get them back on for a follow-up. I did talk to my very good friend with the Lewy body dementia, talk to his wife, and she said definitely, he has not gone really downhill. He's kind of holding his own. There are some things she said that he's lost some ground on, but she says it's kind of wild. There's some other things that he's improved upon since, so I mean, there's a bit of a mix, but at least you don't have a downward trajectory only, right?
Well, I love the fact that, you just see people getting better. And that's why I can't wait for more doctors in our country to see the results of the stuff that we're doing. And I see a question there about, using the handheld laser for the eyes. And I think you addressed that. And that's why, but putting it over the eyes, the light seeps in and just helps,
Yeah, it's got
anything.
no problem going through the eyelid, but why I like doing it that way is because you're going to have a very, very uniform light field on the back of the eye. Like it's going to be so very even. Doesn't matter, so you're not staring at a spot. I did have one person after all the people I told them, make sure you close your eyes. You got to have your eyelids closed. So one person said, Tom, I got a problem. I said, what's that? Well, I was using the light for my eyes, and for some reason I see some spots that I didn't, notice before, and it's still a day later and it's still there. And I was like, ooh, this is not so great. And I says, but I'm just trying to understand. Did you close your eyelids like I said? She says, "Oh no, I had them wide open and I was staring at that light." I mean, and it took 2 or 3 days and it returned to normal. But I mean, she was focusing her onto focusing her eyes on the LEDs that were there. That's not what
It's
we're
a little
supposed to.
bright. It's a
It's a
little
little
bright.
bright, and
It's not
so
necessarily going to hurt the eye, but it'll definitely make it so, you have to readapt, you
yes,
know.
it's kind of like if you go from a really bright room at night and then you go out in the darkness, and it doesn't even have to be that dark, but everything else is really dark until your eyes finally start adjusting. So in
I
her
see it.
case is about 2 days there. There's actually one person here who's in your backyard. I just saw that in one of the questions here. Do you want to scroll up or down? I just think I just saw it. Uh, Oh, do you know a Dr. Wilkerson?
Yes. Yes, I do. He's my partner.
Oh, okay.
Whit is a brilliant medical dental integration doc, and he's actually retiring from our practice in a couple of months, and he really pushes the agenda when it comes to medical dental integration. So, it's great. I'm glad he was on.
So
That's
she
great.
was asking, are you still taking patients?
Yes, yes, I am. Yes, I am. And
Okay, well, there you go. You can look up Dr. Larry Lieberman. You'll find him, and in the St. Pete's. That
St. Pete. Yep.
okay.
I'm
All
I'm
right.
actually I'm actually where the where Pete Dawson's office, and Pete Dawson was, as most people know, if anybody's a dentist on here, I'm sure you've heard of him. He's one of the most iconic dental educators in the world. Unfortunately passed away several years ago, but he left his mark on dentistry that's incredible. And that's his office that I'm in. And Whit has been there for 40 years.
Oh
So
wow,
it's a
wow.
it's a great place to be, and I love being able to share, this type of stuff with Whit and with the other docs in our office there because they didn't necessarily know much about lasers. They said when I retired from my practice, they said bring your laser, come on in. It's right around the block. It's 2 minutes from where I live, so it's been great.
Yeah, so Carrie is asking a question if red or near infrared light can help. How much time would you use it on which setting? Well, that really depends what with my Palm device, the models, but it really depends on where you're treating on the body. Generally, over the brain area and ears, and is 1 minute. We use 1 minute of red and 3 minutes of the near infrared. When it comes to eye health, we're doing 1 minute red, 1 minute near infrared with the eyes closed. And I've got one woman that's in her 80s, and she has used the light now for a year and a half. And she had wet macular degeneration with the injections of the shot injections. She had stopped that because she said she couldn't stand it anymore. It was so much pain during that shot. So her daughter found out that light could possibly be helpful. So that was like a year and a half ago, and this woman has improved her eyesight. First, the floaters went away in her eyes, and then improved vision. I got another one that's 95 years old. She was blind from retinopathy, and totally couldn't see anything, no shadows, nothing. And after 10 days of the light treatment, she could see her daughter's face for this first time in a year.
Wow.
You know,
I mean, there's nothing that I wouldn't believe when it comes to this, that people, if they haven't used it, have no idea what they're missing. And by using something that's effective can make such a big difference in their lives. I mean, I saw a question there about um, uh, Susan had a sister that had knee surgery 12 months ago, 8 months of PT, and she still doesn't have good range of motion. She has scar tissue. Will light? Absolutely, the light will help.
yeah.
Absolutely. I mean, I can't impress upon that enough. I would run, not walk, and start using light therapy on there. And that's what my wife's been doing on her knee. And I've seen it over and over again. People after surgeries, whether it's shoulder, whether it's knee, whether it's elbow, whether it's wrist, whether it's anything. The scar tissue makes it tough. But if you put the light on it, it does make all the inflammation better.
Yeah, and
So
I think
absolutely, Susan.
long enough time, I think you start ending up even helping to dissolve some of that scar tissue. That's some of the things that we seem to be seeing. But we haven't been at it long enough to see for sure. But it looks like there's been some evidence of that happening.
Yeah, somebody was asking about remineralizing teeth, and actually, I don't necessarily see remineralization of teeth with the low-level laser, but I do see remineralization with erbium lasers. So when I have somebody with cervical sensitivity, and I'll use the erbium laser and put an erbium bandage on it, and that works beautifully in conjunction with photobiomodulation because it just makes all the nerve endings seal and it makes all the pain go away. So whether it be a cold sore, you can get rid of the cold sore and get rid of the viruses because all lasers are bactericidal. So you get rid of the cold sore, get rid of the virus, then cover it with an erbium bandage. It just makes it heal and feel so much better right away. So
Mm.
there's lots of things that the erbium can do. So there's lots of different wavelengths, and that's where the story can really extend from here. Photobiomodulation is great, but I use it for lasers for every procedure all day long. It's by my side. I just wouldn't want to practice without it.
Mm-hmm. So again, just we're going to wrap up shortly here. Thank you, Larry, for coming on, but just don't leave it quite yet. Just want to mention to everyone that please remember to go to the SunPower LED website. You can learn a lot of stuff there. But also, I have a YouTube channel, SunPower LED, at SunPower LED. Check it out. I've got all the videos there. We will have this video of Larry and myself, Dr. Larry Lieberman and myself up and probably within the week anyways. Usually it takes up to a week. So we'll have that up. But please, if you go to SunPower LED, please subscribe and also watch a video too, like everybody has done, and put a like on there. That helps us just to expand the number of people that see our program, because as you know, YouTube pops different videos up, and the more likes that you get, the more times they through the algorithm go and pull out videos from different places, and so it really helps our serve. We've got a couple more questions, I think. Just scroll down a little further, please.
The one thing is, Carrie asked about erbium. Erbium is erbium YAG. Erbium is ERBIUM. Erbium.
Do you know what wavelength that is?
2940.
Okay. All right. Yeah, that's
Uh,
much longer wavelength. Yeah.
Yep.
So I
It's a
think
surface laser, because different lasers penetrate tissue in a different way. Erbium laser is a surface laser.
yes.
The infrared will penetrate deeper. The red light is more surfacey. That's why it's great for wound care, for skin. So that's why it's important to know what is the wavelength looking for. Where the erbium will look for water, the infrared will look for pigment, will look for inflammation. That's why it's great to get rid of inflammation and pain.
Okay. A question came through about length of time for treatment, and is there too much? I haven't really seen a too much situation with our palm lights. I know at one point they used to say, "Oh, you got to be exactly at 4 joules and don't do any more," and all that. I don't see that with our LED stuff. I've
Well,
had,
what I see is that all light is good. Okay, you can't do it. I always tell people you will do no harm with it. If it's too much or more than you need, it's just not going to maybe get as healing as well, because you need more power and you need more time for the pain. You need a little less time for helping it heal.
Mhm.
So I think that when you came out with those instructions with the palm, I loved that, because I used to get questions all the time before you had that, and I begged you to get that out there. Now I don't get calls every day to find out how
Yeah.
much time should they put it on, and
Uh,
and
it
you're
is.
spot on. And
Yeah,
if you
it
go
is.
over a little bit, or
Yeah,
it's not a big deal. You
no,
know.
and that's what we've seen. As a matter of fact, I've got a few individuals, that a nice whirling sound of the fan, it can really put you to sleep. And I've had a few people that have fallen asleep with it, let's say on their neck pain, and no problem. They wake up an hour later and there's still no pain. Like it's just like they're thrilled. And so, not that I say you should fall asleep with my light, or take it in bed and fall asleep with it, but it has happened, but to no ill effects. So, anyways, um,
Well, Diane just had dental surgery. She had an implant, and how should you use the palm? Well, the palm, you can just take the palm and put it over your mouth. That's one way. But you could also take the probe, if you have that came with the palm, and you can put it right over the area where you had the surgery, and that'll help it heal a whole lot faster.
yeah, yeah. Well, okay. I think we're going to call it quits for tonight. Dr. Larry Lieberman, thank you so much for coming on tonight. That was fabulous.
You're welcome.
your knowledge on this. And my gosh, how many people have you helped over the years knowing
Oh,
about
so
photo?
many. And it just makes me keep wanting to work. At this point, my wife says, "You can never retire." I say, "Well, not totally. Don't ever want to retire totally because it's too much fun and it's too important to pass this on."
Yeah, and
And I love being able to do that.
one cool thing with your backdrop kind of makes me think of travel. One thing that's really cool with our light is that because we don't have any lithium batteries in our device, you don't have anything that's going to wear out that way. You just plug it in and keep using it. But the other thing is you can easily pack it in your suitcase with no issues at all, whether it's carry on or in your main suitcase in your main luggage because it does not have a lithium battery. So I got people traveling all over the world with their Palm units without any issues whatsoever.
Well, I'll be a testament to that because TSAs all over the world have seen mine, and they're like, "Great! They want to learn more about it."
Yeah. So thank you again, Larry, and thank you everyone for joining us tonight. We will have a draw at the end of first week of October for September. So continue to tell all your friends to join us, and who knows, they may win a palm because you invited them. And you won't win the palm. No, no, no. We have no idea who's going to win the palm lights, but please invite your friends to join us next Tuesday. And thank you again, Larry, for coming on. This was fantastic.
My
And I
pleasure.
wish all of you God's richest blessings on your life. Bye for now.
Thank you. Take care.